story of Healthcare Network is a story of community. Sergio, and I'm the Executive Director of Healthcare Network. Healthcare Network was started in 1987, and it was started as a result of an economic downturn where many people had lost their jobs and therefore lost their health insurance. And Sister Brenda Walsh, who was a mover and a shaker in the community, noticed that this was a need and thought, we can do something. We can piece this together. We can pull together some doctors and they can volunteer their time to see patients who are in need of care, just until we get to the point where people get back on their feet, get their health insurance going, etc., etc. So she was able to do that. She had pulled together a couple local doctors, and we had started in the basement of First Presbyterian Church on 8th and College. And we had a desk, we had a screen, and an exam table. And a couple times a week they would provide services to people who were in need of health care and didn't have health insurance. And that's how Healthcare Network started. It was supposed to be a temporary project. Eventually we were going to get national health care, and that was the talk at the time in the early 90s. And here we are 33 years later and still going strong.
Hi, I'm Colleen Anderson, and I am a proud donor of Healthcare Network. We're so fortunate in Racine to have such wonderful nonprofits and arts groups to support, but one of the top of our list is Healthcare Network. We've been donors for a long time. We appreciate the care that they give to those who wouldn't have care otherwise. We appreciate the providers we talk to tell us how much they like to see Healthcare Network patients because they come in ready to listen, ready to work together for their care, and appreciative. And the outline for success that Healthcare Network gives to both providers and patients really makes everything work with dignity and compassion for everyone.
So in terms of the size of Healthcare Network, there are, across the state of Wisconsin, there are about 100, give or take a few, 100 free clinics, and all of us look different. Healthcare Network is one of the largest free clinics in the state of Wisconsin, both in terms of scope, we serve all of Racine County, and in terms of patients. So at present, we have over 9,000 registered patients. We don't see all of those patients every year. Some of them come and go in terms of eligibility, but in any given year, we see about 3,000 unduplicated patients and most of those patients we see a couple times a year. So we provide, on average, about 6,500 appointments. These are appointments, preventative health care appointments, diabetic education, health education appointments, dental appointments, behavioral health appointments, and all different kinds of medical appointments. All of these would be appointments of people that need to be seen by a doctor and would be going to the emergency rooms or the urgent care centers in order to get their health care needs met if Healthcare Network were not available. For every patient that is interested in using Healthcare Network's services, they go through a complete screening, and the screening begins with an insurance screening. So we look to see if you have insurance, if you're eligible for insurance, or if you're eligible for other programs that you might not know about. Occasionally we have patients that have an insurance card in their pocket and don't know how to use that. And so those would be the patients that we help get them established with medical care, get them established with what we would call a medical home, and teach them how to use their insurance. If the patient doesn't have insurance and is not eligible for insurance and lives in Racine County and earns less than 250% of the federal poverty line, then they would be eligible to use services at Healthcare Network. We fill out the application and they get an appointment to establish care at Healthcare Network. In terms of the distribution of patients that we have from an ethnic standpoint, that changes to mere public policy. So prior to the Affordable Care Act, the Medicaid program that we had typically served low-income parents that had children, so custodial parents. When the Affordable Care Act changed, the state of Wisconsin changed the Medicaid laws too. And it included people that earned 100% of the federal poverty line or less. And it took a lot of the patients that Healthcare Network had and put them on insurance. So that changed our patient population. Currently, the vast majority of our patients are of Latino descent. So we have all of our staff, well, the vast majority of our staff is bilingual to be able to provide interpretation for our patient population. So Healthcare Network is very unique in its approach to serving our patient population. We have the clinic that we're standing in right now in Racine, located right downtown Racine. We do have a satellite clinic located in Waterford for our patients that are on the west side of the county. And then our volunteers are given the opportunity to practice in their own clinics also. So effectively, that gives us offices or medical offices across the county. And so one of the things that we do with our patients is we try our best to match up our patients with our volunteers in the best way possible. So where does the patient live and where is the volunteer that we could link them together with? What services does that patient need and what resources does that patient need? So we take into account transportation, daycare barriers, all different kinds of barriers that our families would have, and look for what is the easiest for them to access care throughout the county. So our volunteers are, first of all, the most amazing volunteers in the entire world. We have currently about 300 volunteers, doctors, dentists, hygienists, medical assistants, nurses, and everything under the sun. So some of them choose to come on site to one of our on-site clinics and spend a day in the clinic seeing patients, and Healthcare Network staff does all of the volunteer or all of the coordination of care. Some of those volunteers choose to practice in their own offices, and so scattered throughout their regular patient population, they might have Healthcare Network patients. The good thing about Healthcare Network is that the patient population meshes with the volunteers' regular patient population. So Healthcare Network patients do not stand out. Nobody would know that they're a Healthcare Network patient. They just are blend in with the regular patient population, and that's what our goal is.
Hello, I'm Dr. Reginald Adams. I'm a family medicine provider at Ascension Medical Group, and I'm one of the physicians who see a lot of the patients from Healthcare Network. I grew up in Racine. I have a lot of friends and family here in Racine, and I'm happy to see that Racine has a dedicated clinic like Healthcare Network that helps the underserved neighborhoods and families that really do need their help. Medical issues, pathologies like diabetes, asthma, hypertension, they all have significant effects on the communities that are supported here by Healthcare Network. If you have uncontrolled asthma, you can't work, you can't support your family. If you're a child with these kind of issues, you can't learn well. So services like Healthcare Network are extremely needed and well appreciated. And I'm happy to be working with Healthcare Network.
My name is Dr. Scott Monroe. I'm a volunteer dentist here at Healthcare Network. I've volunteered for about 20-some years, having patients come into my office here in town, and then also now volunteering in our fabulous facility that the community built here in Racine. The patients that I see are those that are medically uninsured and dentally uninsured, and they have nowhere else to go within the community. The patients that we see are so grateful because this is the only option that they have to receive the necessary treatment. I also want to say I'm very proud of all the dentists within the community because nearly all of them have volunteered over the years to help the individuals in our community. And it's important, and they feel it's important to give back to the community that supports them. As a healthcare provider and a dentist, it's in me to always want to give back and to make a difference. And when I come in here and I see the people that I'm able to help, when they've come into my practice over the years and I've been able to help them, get them out of pain, replace missing teeth, give them back their smile, I feel like I'm really making a difference. And I think that's what most of the dentists, the volunteer, and the other fabulous volunteers, what they get out of this.
Hi, I'm Greg Mueller. I am the president of the Healthcare Network Board. Well, like a lot of the people here that want to give back to the community, I felt as passionate about it. And healthcare is definitely a vital need in our community. A lot of people don't realize the barriers to access, and I wanted to be a part of an organization that fills that gap. I found the Healthcare Network has the most professional and organized staff of any organization of its kind. The staff and the doctors and other providers here are top-notch, and they really emphasize the care in Healthcare Network.
So in addition to all of the medical care and the dental care that we need and the volunteer positions that we need to provide that care, we always have need for help in the office, for help answering the phones, for different kinds of projects that we might have going on, technology needs. We're a nonprofit, and so we always have different sorts of volunteer opportunities available, and those are ever changing.
I do simple things like paperwork, pulling charts, calling patients, reminding them. I'm also part of the Preventing Blindness program that I work with Crystal. I learned about this place with Allison because she came to Parkside, which is where I'm a student at. I was in a class where she came in to just speak about Healthcare Network, what they do. They were searching for volunteers. At the time, I didn't volunteer, but then later on when COVID seemed to be more settled in and I wanted to help people with things, I decided to contact Allison and Crystal and see if they needed any help with anything. I have seen a lot of people feel really comfortable here. A lot of the patients that come here for either like dentist or diabetes information or being checked up by nurses or doctors here, they seem really comfortable with the staff. A lot of the staff know them by name. Even when they call them, they like immediately recognize their voices. And a lot of the patients here also request a lot of the nurses or the people who work here by name, and it's like they're friends and everything, and you can really see how comfortable they are with the patient and staff, and the relationship here is like just really comfortable.
When we have a patient who is in need of care that is extensive, for instance, a cancer diagnosis or in need of surgery, we are able to call our partners at either Ascension or Aurora and make arrangements for that patient to receive care. Both of those hospital systems do have a charity care program, and oftentimes that charity care program will cover a portion of their diagnosis or a portion of the care that they need. And what we do then is we provide the services and work well, partner together with the hospital to make that treatment plan seamless and to reduce any cost that there might be to the patient. So oftentimes we're able to get those bills written off, and then sometimes there's just no charge altogether. Healthcare Network is always in need of support from our community. So it takes the entire community to make sure that this community stays safe and healthy, and that is our main mission. We want to make sure that people who don't know about Healthcare Network know that there are opportunities to volunteer, there are opportunities to donate, there are opportunities to support the care that we give, and that is how we live out our mission. We can only do this with our volunteers and our donors. We can only do this with you.